So you want to, it's gonna automatically default to recorded. So I forgot cease recording it now, just hit pause right away.
Properly posted. Yeah. I believe it was, yes. Thank you. Roll call. I see that we have 1, 2, 3, 4, 5, 6, 7. All right, here, so we're properly, quorum. We'll move to, let's see, I better get back on the agenda. Approval of the June 17th meeting minutes, Pine Valley Subcommittee meeting. If you've looked those over, if I'm hearing no corrections or additions or changes, I'm going to declare those approved as published. We have an 8-point agenda tonight. I'm looking for approval, a motion to approve that agenda. Mr. Manning, seconded by Mr. Cooley. All those in favor, say aye. Aye. Opposed? Have an agenda. Takes us down to public comment. Do we have anyone here for public comment? That would also include any board member who wants to, just because you're on the board doesn't mean you lose your public status. Yes,
Mr. Chair,
Sandy Kramer.
I would like to see on our agenda, if possible, for next month, where some of us had discussed at the county board meeting, a public apology for the Pine Valley employees, the ones that are still there, the ones that have left. And I would also like to see a apology start from this committee to move to the county board agenda. And I'd also like to see an apology made to one of our citizens and a county board member, Elaine Hendricks.
Okay. Anyone else want to comment on that or any other topic? Okay. I will include that as an agenda item at the next meeting.
Thank you.
And it can get full discussion at that time
Okay, great.
as an agenda item, but it has to be on the agenda to do so.
Okay.
Okay. Anyone else? Anything else? Pine Valley financials.
Yes, we're gonna start with the accounts receivable trend report. I have it up there on the screen. This is a report only. We look at this every month and it shows our uncollected accounts receivable. The goal is to be under 40 days, and as you can see, we just got, we were well under that, but at 28.76 days, which is extremely well. And, the biller does a great job. There's been some movement on some accounts that also help. So just a report only to share with you. And the next is a consideration of vouchers. So the cover sheet here shows our cash receipts for the month of June at $856,928.78. We have our typical expenses, noteworthy that for payroll that included Memorial Holiday. It was paid out in June. And also the vouchers make note that at the $287,298, we did pay back to the state of Wisconsin $84,517 for the SP recoupment that we talked about last month. That brings us for the month to a negative cash flow of $31,371.54. And then we will go through just a few that I want to highlight, and I welcome any questions. So on the first page, check number 10813, we just talked about that, to Wisconsin Forward Health, paying back that SP recoupment. We got it in December. We ended up only getting to $53,000. We returned the $84,000. We always go over the credit card, the next check, which is 10864. That included 2 ice machines for dietary at $5,298 capitalized, $1,000 for training for fire safety class for Chad Williamson, the new maintenance supervisor, and then $640 for dishwasher parts, and then just many miscellaneous charges in there as well. Was there any questions on that first page? Second page, check number 10884. We had a door opener for dietary that got repaired, automatic door opener, and that was $900, and then some building keys. Check number 10893, St. Joseph Equipment, that's for a Ferris zero-turn lawnmower that drastically reduced the time maintenance spend mowing lawn at $9,700. That came out of the capital fund. And I also wanted to make note, or we always talk about how much contracted staff we have for the month. Our total contracted staff in June equaled $43,239. Next page. Check number 10903 for $1,594.10 for Easy Way. That's a stand lift for the CBRF, and the foundation will be reimbursing Pine Valley for that purchase. Check number 10906 for JT and Associates. It's the second last payment for our Medicare cost report for $1,125. And that was all I had to point out for the vouchers, but again, if there's any questions, please ask.
I would ask, on page 1, the great tree medical staffing, 26,000, is that, I'll direct that to Angela, is that, as for contracted
Contracted staff.
services? Is that going up or down?
That is going down. I will be out of contract staff by August 10th in the SNF side, and then August 28th on the CBRF side. I did keep them 1 week longer because we have some new trainees coming in. I want to make sure they're trained and not just thrown on the floor, so they have a good training and everything. But by September 1st, we will be totally out of, knock on wood, out of agency staffing.
Nice. That's wonderful.
Mhm.
Wonderful. Okay, anything else, Therese?
I guess I need an approval on the vouchers.
All right, I'm looking for approval of the vouchers.
Also,
Second, Andy, seconded by Mark. All those in favor indicate aye. Aye. Opposed? Okay, we paid the bills.
Then we have our aging report. This is something we do quarterly to keep everyone informed of any problems with collections or accounts. I removed the names from what you see. I do want to point out number 6 for $14,965 that has been paid. That just got notified of that today, so I didn't correct these. They're already posted. Other than that, point out number 1 that has gone in the right direction. We're getting monthly payments, so that will be paid off, I would imagine, by the next time we go over this quarterly. Number 8, this person is also making $2,300 a month payments, so we're getting agreements made when there's a problem and people are upholding their agreements. Number 10, we had that Medicare 5 claim review, and all of them have paid except for this one, and we did submit more information to them. So hopefully we just haven't heard back. There shouldn't be an issue with that. Number 13, we've talked about before, that supports managed Medicaid outpatient. We no longer take them because they gave approval and then they rescinded that approval. So we're just going forward, we won't accept that for outpatient. The total liens would be number 11 and 12, and that's at $43,203.50. The number 15 is a large one. There's that probate case is still open. I'm not sure what will happen with that, but it's there. Any questions on this at all? It's a report only. Then we're gonna take a look at the census. And I don't know, Angie, if you want.
So, yeah, with our census, we are currently at the building right now, we're at 56 residents. We did have a rough couple here weeks. June, we did have 8 admissions and 6 discharges, so 6 people that went home because they were done with rehab. So for July so far, we've had 11 admissions so far. We've had 6 of them, not just them, 6 people have went home, and we have, in the last 2 weeks, had 5 deaths. So we are down a little bit, but Ryan and Jen are working very hard out there. I think we have 5 referrals they're working on currently, so we're getting, we have to take our losses with our good ones, so the 5 deaths are not ones we would have expected. I mean,
That's an unusual amount, I would.
that is a lot for 2 weeks, absolutely. So,
Good, good.
and then in the assisted living CBRF, of course, we're still full over there.
So the last thing, one of the last things is the financial report here. And we always take a look at, the operating cash, sort of bottom of the first page, 10010, like that, we did have quite a few expenses in June. So that is still over 3 months at, 3,211,000. Is just over 3 months of operating expenses, and that's our goal, is to maintain 3 months of operating cash. The capital improvement went down slightly with the purchase of the mower, but other than that, I don't have anything on the balance sheet. And then we'll take a look at the statement of operations summary.
For that, you'll need to sign into a Wi-Fi network first.
So you can see just at the top with the revenue, our low census. Compared to what was budgeted, we're down 236 days. And so that certainly affects our revenue. When we have the lower census. So year to date, we're down compared to budget 370,722 with our revenue compared to budget. As far as our operating expenses, you'll see the red for the nursing administration. In that, we did have, of course, a new DON, and there was some cross training. So there was some overlap with an RN manager helping out. Housekeeping, we'll look into that. That's over a bit as well. Assisted living at over for the month at 17,945. That is attributed to the contracted staffing and the low staffing we had there, but that has certainly turned around. Yeah. So then, you look towards the bottom, total income loss from operations, we always add back in the depreciation, which is a non-operating expense, as is the interest on the loan. And then I had to put in that SP recoupment because that doesn't hit our statement of ops. So total income loss year to date is $433,377. We're hoping that we'll start getting that turned around with some lower staffing, less contract staffing, leave commissions. Is there any questions at all on that? We do have a cash flow report. So even though when we talk about it, you can see for the month, our cash flow, cash receipts, 856,929. Our expenses were at 888,300, so for a negative cash flow, 31,372 for the month of June. That's all I have for that financial reporting.
Okay, thank you. Administrators report.
Oh, great. So I kind of went over our census or whatever. Our CBRF, like I said, will be out of agency staffing over there. We did hire a new CBRF manager. Her name is Natalie Turner. She will be starting July 29th. She, is from the Blue River area. So our SNF, like I said, we will have no agency over there. We do have some college kids that are going back, but as of right now, we have hired 7 new CNAs and 3 new nurses that are gonna be joining our staff here very soon. Housekeeping, Chad is currently fully staffed, but we are still interviewing for on-call staff. So we had a couple interviews on them. Dietary, she has a part-time position. We have 2 interviews scheduled tomorrow for them. I am also working with a company called Ageless Interventions. So what it is we can get up to 28 robotic dogs or cats for free. It's a grant program through the state of Wisconsin. They come to our residents. The resident can keep them. It's just like, it's a robotic dog and cat. It don't cost us nothing. It's called Furry Friends Project. It helps with dementia, aggravation, depression, and all that. So that is something I'm working with that company on and getting those in. Hopefully we'll have them in by January of 25. Because we have to have the grant in by September and then they review them. And also we have a farmer's market that comes out there every Wednesday. Residents and staff enjoy that really very, very much. We have an all-staff meeting on July 25th. It is just a staff meeting. We have to have continuous education. We have to have 12 hours every year. And this is just one of them educations that we have to do by state requirements. Plus we'll have answer questions and anything like that. Some training that we've done out there. So we had our bus training. So anybody that wanted to learn how to drive our bus, we had a lady come in. It didn't cost us nothing. She went through, she certified everybody. Last week we sent Mallory to Clam Lake for a free training up there for the bus. So now she can train our staff. Chad is taking Thursday. We'll be taking the safety training. So he will be able to do all of our fire and safety training out there. Jessie, she does all of our medication and standard precaution training out there. So all of our training now will be in-house. We will not, the only thing we would be is our CNAs. Which we have that grant through Care Wisconsin, which if we get people to come in and sign up for us and work as resident assistants, go to the class, the facility itself will get $2,000 and the employee will get $500 once they pass their test. So that is something we're trying to get out and about. There's a lot of facilities that do it. We also are having a baked potato bar, I think it is, for Thursday for our staff, just at the meeting, and a little thank you for them.
How did the chicken barbecue go?
It went very well. We were sold out of chicken by noon. Yeah. I believe it was. We were sold out of chicken by noon.
So good.
Yes, it went very, very well. So.
We had 200 halves of chicken.
Mhm.
More next year.
Yeah. And then we do have CNA students out there right now from Southwest Tech. They're doing their clinicals. And then in mid-September, October, we will have a nursing class out there doing clinicals.
Wow,
So
super, super.
we are doing very well.
Is this something new?
The students, no,
The nursing students?
no, they've always been out there. I would like to I'm working with Angie. She is one of the nursing student teachers out there. She comes with them to the clinicals. I would like to get a class, a CNA class at the facility. Schmidt Woodland Hills does it and Greenway Manor does it, where anybody from the community come in, they can take the class. And I mean, it's just great community service for the facility. So I am working with Angie and Jill, Sherry on that to try to get us to be a site.
Where did your nursing students come from, or nursing employees come from, the five?
The 5 we just hired, so, Natalie's Blue River.
I mean, where did they come from? Other places?
Yes,
or-
so Natalie is moving to Blue River. She was from up north and her husband got transferred down here, so she's transferring down here. Janet, she is coming from Upland Hills in Dodgeville. So, cause they're they're not closing, they're refining their SNF. They're taking away the nursing home and making it an assisted living. So there's people coming from that. Trying to think of it. And then Mark and Kate, they were PRN staff, they have come on part-time with us. So now they will be in the schedule. And then who is their other nurse? Jody, I believe, yes, Jody is coming with Hannah from Flint Hills. So, and they're both from the Highland area.
So last month you talked a lot about different marketing suggestions and ideas to increase our census, and I'm wondering how that's going, or.
So Jen and Ryan sent out emails and make phone calls. I haven't been able to get them out in the field, because as you know, we've had 11 admissions and
Sure.
it's all hands on deck. I mean, they do 2 or 3 admissions a day, so, I mean, and they've had tours, they've had family members call. We're offering tours, you know, they come out, meet the staff, take tour of the facility, you know.
Got a question. When you get one of those robotic dogs or cats,
Yes,
could you bring one in?
you bet I will. You bet I will.
Yeah, I'd like to see.
No
those.
robotic donkeys, so.
Bet, yes.
But can we keep it?
I don't know.
Yes, they are ours to keep. You can't keep it, but our residents got it.
When they bring them, there are.
Yes, they're ours. It's a grant that the state of Wisconsin got. It's through a dementia training depression. It's like for mental health. And it's for the nursing homes in the state of Wisconsin. So as long as you fill this paper out and put like what you want and everything, if they approve it, then you will get them and they'll bring them. And I did ask that, 'cause I'm like, because it says in the thing, like 1 year, I'm like, what happens after a year? Do we have to buy them? She's like, no, the year's to keep.
They do the maintenance or we do?
Yep, no, they take care of everything.
Great vet. I appreciate you knowing all the names like you do.
Oh,
That's amazing.
thank you. I appreciate it.
Thank you, Angela. RFP electronic health records.
Update on that, so we did finally get a pricing, for Matrix. So they have offered to give us the first 2 years of what we are currently paying, because they feel it's not our fault that the company that we have our current one through is not gonna be available. So we did finally just get all that, I sent that over to, Mike and Larry to look at, and then hopefully September-ish, I'm hoping to be able to get it approved to the board and everything, so we can get rolling on, because December 31st, we will lose our current electric medical records.
And why is that?
They got bought out by Point Click
Care, and
which is a much bigger company and much more expensive than.
they're very
Matrix.
expensive.
They charge for each little component.
Yes, they sell you a base package, so it would be like a base, and I've used Point Click Care a lot. They sell you like the basic package to get you what you need, but if you wanna add somewhere like Therese could go in and put in something for billing or something like that, or a doctor wanted to put a note in, then you have to buy a separate package. So they sell you the base package, but then there's all these other little packages. Matrix, they're gonna sell us the whole thing, which will include the sniff along with our CVRF for what we're paying currently.
And Angie, will they come on site to train?
They will come on site, do all their training and everything.
That's so nice.
Mhm.
It smells like you.
I don't like the sound of that, but I discovered that like Richland Hospital cannot talk to universities,
Correct.
the records are.
Yep. And one thing about Matrix can talk to a lot of different, like they can talk to Epic, which is a huge one. I
Yeah.
don't know how, like for billing and stuff, how that will, but I mean, the doctor, we asked
The billing
Dr.
looks
Brad.
really good. They're Point Click.
Yeah.
Yeah.
We have talked to Dr. Brady about it. We also talked to Dr. Sadu about it, and they said that Matrix will talk to just about anything, so.
I guess it all is a far cry from the days when you wanted your health record. You carried them with you.
Yep, yep.
So now is this Matrix with Richland Hospital? You
No.
can go there, you can.
It will talk to like if you were at Richland Hospital and you came to the nursing home and all their files, they can send their files over in, is what I mean when they talk. So it can download them into that file.
If that's possible, but I was told, like at University Hospital, I was there well, we don't have, your last CT scan. I said, well, this Richland can
Send
send it
it.
to you. Well, they'll have to take a photocopy of it, download it and send it by snail mail.
Wow.
Okay. Supposed to be faster. Anything else from anyone? Okay.
I just
so-
want to say,
Yes,
like, I volunteer a couple days a week mornings, and it's so much more pleasant than decent work.
I did, Pat. I love you, but I didn't hear any of that.
I spend a couple mornings a week, usually there, just volunteering. And it's just like a night and day difference, so wonderful atmosphere there now.
That's it.
Remember what it was.
Thank you for that.
I
Thank you.
stepped it up.
Night and day different. It's good to hear. Okay. Brings us up to number 8. All in favor? Aye. Aye.
Well, how your township is, that's our. Not too bad, Randy said we had some.